What happens when a person enters the machinery of U.S. immigration enforcement and never comes out alive? This is the story of one man, Jean Wilson Brutus, whose death has ignited outrage, raised alarms, and forced a reckoning with a system built on secrecy and detention. Today, we're dissecting not just his final hours, but the patterns of neglect, power, and accountability in American immigration detention network. Jean Wilson Brutus was a 41-year-old Haitian national who had been living in the United States for over 2 years at the time of his death. According to official statements, he entered the U.S. on June 20th, 2023, at the Hidalgo port of entry in Texas, and was granted parole while his immigration case played out. Brutus was not a high-profile criminal. ICE described this record as involving multiple local arrests in Elizabeth, New Jersey, for criminal trespassing and criminal mischief, property damage, charges that local police processed and released him on multiple occasions between 2024 and November 2025. Importantly, ICE officials stated that he showed no signs of distress upon intake at the detention center and had no reported history of cardiovascular issues. On December 11th, 2025, after his latest arrest, Brutus was taken into custody by U.S. Immigration and Customs Enforcement, ICE, and transferred to Delaney Hall Detention Facility in Newark, New Jersey, a controversial, privately operated migrant jail.
We're here in support of the visitors and also to pray and have a service in remembrance of the people who died in detention.
This is the moment when an ambulance left the facility on December 11th. According to ICE, that was the same day 41-year-old Jean Wilson Brutus had been taken to Delaney Hall. They say once in custody, Brutus had a medical emergency and was taken to the hospital. His death was confirmed the next day.
Marie-Angèle Blaise.
Presented.
At the vigil, his name was read along with many others who have died in custody. According to ICE, the man, who's from Haiti, entered the United States through Texas in June of 2023. He was granted humanitarian parole to stay in the country while he was waiting for his immigration proceedings. Brutus was arrested a total of 4 times, but ICE did not tell us if he was convicted of any crime.
We want to show them compassion and to make sure that they know that there are people in the world who support them.
Delaney Hall is operated by Geo Group, a private company that received a $1 billion contract to run the facility. Advocates also took the chance to give away toys and food to families of those who are in custody.
What we're trying to do is extend a little bit of joy to people who are not experiencing much joy with their loved one or family member in prison.
Less than 24 hours later, he suffered a medical emergency inside Delaney Hall. Local emergency medical services were summoned, and Brutus was rushed to University Hospital in Newark, where he was pronounced dead. U.S. authorities claimed this death resulted from suspected natural causes and described it as completely unexpected. But advocates, lawmakers, and immigrant rights groups see this as something far more troubling, not an isolated tragedy, but part of a pattern of systemic failures. Delaney Hall in Newark is one of the most recently opened ICE detention facilities, a 1,000-bed center run by a private prison contractor. It has already become a focal point of protest and legal battles over its conditions and oversight. Critics argue that private profit motives, insufficient medical staffing, and lack of basic transparency have turned places like this into environments where people are treated as liabilities instead of human beings. According to ICE, Brutus showed no signs of distress during admission and had no known chronic health conditions. Yet, within hours, he was experiencing a life-threatening emergency. Activists present outside the center reported that the ambulance carrying Brutus was delayed at the gate while another vehicle entered the facility, raising urgent questions about how emergencies are prioritized and handled. No full medical report had been publicly released, leaving a vacuum of information about what happened inside those walls. That secrecy is what makes this death so ambiguous and so disturbing. Brutus' death is not an outlier. In December 2025 alone, at least 4 detainees died in ICE custody within a span of 4 days, including individuals from Bulgaria, Nicaragua, and Eritrea, making this year one of the deadliest in decades. According to ICE's own reporting, the total number of detainee deaths in 2025 has climbed to at least 30, the highest in years. These deaths span facilities across the country, raising a grim question: is this a coincidence or a structural failure? Human rights organizations and advocates point to overcrowding, insufficient medical care, delayed responses, poor nutrition, and neglect as persistent issues in ICE facilities nationwide. Detention centers are legally obligated to provide adequate medical screenings and emergency care, yet reports from past and current cases show wide disparities between policy and reality, with devastating human consequences. When people are detained, often for nonviolent minor offenses, they lose control over their health care, their safety, their freedom, and in Brutus' case, ultimately their life. This is a system story, not just about one man's death, but about a system that detains tens of thousands of people far from public view, with limited transparency and weakened oversight. Critics say that when the state holds someone in custody, it assumes full responsibility for their well-being. Yet, families, advocates, and politicians are now demanding answers. Was Brutus giving proper medical screening? Was his emergency response delayed? Why did it take days for ICE to publicly announce his death? How many other deaths could have been prevented? These aren't just questions, they are accountability demands. Jean Wilson Brutus was a human being with a story, a life, and dreams. His death forces us to ask whether detention should even be the default of immigration enforcement, or whether human dignity can ever be protected within a system that trades liberty for cages. Because when a person dies inside a facility that the public rarely sees, the question is not just what happened, but who will bear responsibility.